So hi, my name is Dr. Dalsi Wanda. I'm a clinical and radiation oncologist. That means a doctor who treats cancer using chemotherapy and radiotherapy. So today I decided we talk about a certain term that is used often, but I'm not very sure we all understand what the term is and what it means. So there is the term cancer survivor, and it's used very many times. But most people assume it means someone who's finished all the cancer treatment, someone who is done or has been declared cancer free. However, the definition of the term refers to the whole spectrum of the journey. So, someone who's been diagnosed of cancer today is still considered a cancer survivor. Someone who has been cancer free for the last 20 years is still a cancer survivor. So, it's a term that can be used for anyone diagnosed with cancer. The different aspects of treatment where they are on treatment with a recurrence, they're still cancer survivors. And it's important to know that because it helps people use the term with confidence, even if they're just beginning the journey. And I think what we don't really think about is the other aspects of cancer survivorship that affect a cancer survivor. For example, family issues. Remember, cancer has been known to be a very lonely journey. And even when you have a lot of love and support besides you, you feel quite alone and lonely. So there are certain family issues that come up during the diagnosis, during the treatment, and even after. And sometimes there's worsening of already existing family problems. It's unfortunate that many cancer patients are left on their own. Perhaps their spouses finding it the time to leave to get new spouses, and that can be quite lonely. The other thing is that the cancer journey is long. It's not the same as being admitted for malaria, where you're in hospital for a week and after that you're gone. Some of the treatments can go for 3 to 6 months. And sometimes compassion fatigue sets in, and you find friends and relatives don't visit as much, and that can cause a bit of depression and that feeling of isolation, feeling of not being understood, and depression. So, cancer survivors go through a lot of emotional turmoil from the family aspect, from the self body image concept if they have lost an organ, be it a limb, be it a breast, be it any part of their body. There is the loss of grief that goes on with a change in the body look, a change of from being a healthy person to now someone who is on continuous treatment. And that cycle of loss and grief is important for the cancer survivors to know it exists, for the caregivers to be aware that the people they are with could be going through loss and grief, and that would help them have a greater understanding. Remember, for example, if you're being treated for breast cancer, then you're coming into hospital every 3 weeks, possibly for chemotherapy. And that sort of becomes the cycle of your life. Every 3 weeks, you're in hospital. Every 3 weeks, you're in hospital. And sometimes when you're done with the treatment, sometimes you don't really know what to do with life anymore. You are used to coming into hospital. And now negotiating life without that routine of coming to hospital, negotiating going back to work, negotiating going back to family responsibilities full swing becomes a bit difficult to adjust to. And it's important for that counseling to have begun at the very beginning of the diagnosis so that the reintegration into life outside the constant coming to hospital can happen. Patients who've had radiation can have late effects that can be the fibrosing, the change of the skin, sometimes even pain that comes as a late side effect of the treatment that we did. Some treatments of cancer can even cause a new cancer to develop. And it's important for us to know that the cancer journey is not only hard when someone is going through chemotherapy. It's not only hard when someone is going through radiotherapy. Even 5 years, 10 years after treatment, a cancer survivor can go through a lot of late side effects. It's important to know that can happen so that we're not labeling the survivors as malingerers, as people who don't want to work. There is sometimes chronic fatigue after treatment that remains that might make this person not able to work to their full potential in the past. Remember, when you're on active treatment like chemotherapy, it's easy for you to remember your follow ups. The duration is short, it's maybe every 2 weeks or every 3 weeks. Later on, it's maybe monthly, then 3 monthly. And as we go along, the reviews become longer. Maybe you're asked to come every 6 months or every 1 year. And that is long. What we have observed as oncologists is that sometimes we stop going for these follow-ups. We stop going to hospital to be checked because you realize it's 3 years since I was in cancer. I'm fine. I don't feel anything, and you find many stopping the follow-ups. It is not a wise thing to stop follow-up because cancer can come back 5 years later, 10 years later, and sometimes be more aggressive than even the initial disease. So these follow-ups have been studied. You're not just being asked to come to hospital just for the sake of it. It's important. Studies have shown in the first 2 years after treatment is where the recurrence is highest. So you'll find in the first 2 years, perhaps your doctor want to see you monthly or every 3 monthly, depending on the cancer we are treating. And going for those reviews is important. Some patients tell me when they come to hospital, the morning before, the day before, they have nausea. Some even vomit. Just remembering the chemo experience is traumatic. So it's important to have therapy to deal with the psychological torture that one went through during the active treatment so that the following reviews are not as traumatic. One can be able to come to hospital without evoking very strong memories, very strong feelings, and even nausea that is coupled with what was happening during chemotherapy. So these reviews are important. So what I am saying, in survivorship, psychological counseling is paramount. It is important for us to treat you physically, but also to cater for you emotionally. The emotional weight that cancer treatment has is quite heavy. And when we separate the two, then a patient is not able to navigate post-treatment and even the treatment without a lot of emotional damage that is going ahead. So if you are a cancer survivor and you have never gone to therapy, kindly make time. There are organizations that are offering counseling services even for free. We have Faraja Cancer Center where therapy can be offered online, can be offered even physically when you show up to the center, and it is free for cancer patients, for the relatives, for survivors, and it is very important. I think in Africa we don't really emphasize on the need for therapy, and many people have never gone for therapy. But believe you me, as a cancer survivor, it is an important aspect. It is important to make time. There are psychological scars that are there, and therapy will help you debunk them, demystify them, cope with the emotions, and that will enable you to be a person who is able to face the future with confidence. Thank you.